We begin tonight with a shocking move to the Connecticut healthcare system. Several people woke up this morning to find out Prospect Medical Holdings had filed for bankruptcy. This now puts the future of the Eastern Connecticut Health Network into question. And with 53 listed locations in the state, lawmakers are doing what they can to keep healthcare in the community.
It became clear that this is the direction they're going to go.
In a disappointing turn for State Senator Saud Anwar and many others, 9 years after Prospect Medical Holdings bought hospitals in Connecticut, the Los Angeles-based company announced it would file for bankruptcy. This follows a growing debt the company faced as it failed to pay back suppliers, doctors, and hospitals across the nation.
They stopped paying the right amount of funding, and they started to squeeze the amount of money that was being sent.
We're not going to run around with our heads cut off. We need to deal with this in the short term.
Leaders quickly reacted, like State Senator Jeff Gordon and Vernon Town Mayor Dan Champagne, who said this news was not unexpected. However, Champagne assured the community work was already being done to keep things as normal as possible. In an email to Fox 61, the mayor said, quote, "The key thing for our communities to know is that Eastern Connecticut Health Network will continue to care for patients and provide the medical care our communities have come to rely on. Patient care is still #1 for ECHN," end quote. The Vernon mayor among those in conversation with hospital and state leaders, including Governor Ned Lamont and Attorney General William Tong, who both sounded off following the news Sunday morning. Both vowed to hold Prospect accountable in their obligation to provide quality care to Connecticut communities.
Yes, it's scary and concerning and anxiety-provoking, but you need to know that we are all in this together. We are going to be there to help protect you.
I want to reassure people when they need care, go to the emergency room if you feel you have to. If you need local health care, still do that. But we need to see what we can do to really get this away from Prospect, keep these hospitals and ECHN open and running and providing services and providing the jobs and the paychecks to employees, and then see what we can do moving forward. So we need to deal with saving the systems now and then preventing this from happening to any other system in the future.
And in an email to our newsroom, the governor told us the state will look at opportunities to transfer the hospitals to another operator. And both senators we spoke with today hope this will bring Yale back to the table.